This one is a little bit challenging, very interesting questions. Let's get to it. Fundamental of nursing, as usual. First question, same strategy, read from the back, select or apply, concept. Which of the following is consistent? You see what I'm doing? Underline keyword with the filing process. And this is filing what? Incident report. I keep on underlining. After a client fell in the bathroom, which of this is consistent? So the word is being asked. This is the way I'm going to use for all the questions. This is the test-taking strategy. The ask is what? Consistent. Okay, in the case is somebody fell and I need to do what? File incident report. That's all. And the buzzword, incident report. Consistent. Content I'm going to use, what do I do when I'm filing incident report? The report was placed in the client's record. No, you don't put it in a client record. It's confidential. You go to risk management. Next include what? Or next included objective description of the event. Yes, objective, what she saw, that is objective value. Values that is measurable, right? Was included in the event. Subjective information were placed in quotation marks. Subjective is what the patient tell you. I fell, I hit my head. Those are all subjective because you never saw it. What the patient is telling you is all subjective. So those subjective should be placed in the quotation mark. So that's right. The time, location, and client name was in the report. That is good. When you know where it happened, what time, and then who was involved. Unnecessary intervention were omitted in the report. Wrong. Interventions, whatever happened, and you find the patient, whatever treatment, intervention was performed should be included in report for the risk assessment. Therefore, this number 5 is wrong. This is consistent. So 2, 3, 4 are your right answer. Number 2. This is a long case, but I just want to illustrate something. Which of the following step the nurse should take? That means step. Next step, priority. A competent client, buzzword, present to the emergency room with chest pain. Emergent cardiac catheterization is needed, right? The client was brought in by the ambulance and no family member is around. Which of the following steps the nurse should take? There's something I wanted to teach you here. We have a competent client, came into the emergency room, chest pain, any cardiac catheterization, no family member around. What do? Do you call the family for consent? He's a competent guy. He does not need family consent. Keep client belongings under the bed. If this is the bed and then client is laying on it, if you put it here, it's going to get lost. Wrong. Secure client valuable by the facility protocol, whatever protocol, whether you have to call security to lock it or you lock it in your office or there's a room designated for each patient you put in after the cardiac catheterization, then you come to that room. Is the best answer. Call family to come for the client valuables. No, you don't need to do that. So 3, when you have a patient, secure their belongings based on facility protocol. Number 3, and let's assess the bowel sound of a client with small bowel obstruction. Which of the following assessment describe the next action? Which one describe the next action? That means the nurse assesses the bowel sound of the client with the bowel obstruction. Which one indicate what she's doing? Is it a comprehensive exams? Is it a system exams or social or focus exams? A comprehensive is the one that you do from the beginning. You require history and physical exams. There's no history here. System means you focus on the GI system, the whole system. Social, talking about your family. Focus is when they have symptoms. So they have bowel obstruction, where they have symptoms, and you listen to bowel sound. That's when you do focus exams. This is just concepts. Number 4. As I do it, I show you the way you can approach questions. And this is now aware of what? 4 clients. Which client need immediate intervention? Priority. You have to be sharp. Who you don't have time with. Asthma patient, right? He's taking prednisone. It's a steroid. What do? Weight gain and edema, normal finding. Whenever you take a steroid, you're going to gain weight. You have water retention. Don't worry about it. Hypertension is on enalapril, right? Which is an ACE inhibitor. Cough, dry cough. This is not angioedema. Don't worry about it. Change it to ARV. You have CHF on furosemide. You have dizziness when you're getting up. Yeah, get up slowly. Therefore, C. diff on metronidazole and a small blisters on the torso. This is Steven Johnson syndrome. Bad problem, bad problem, bad problem. That's your answer. You see how you do prioritization? So easy. You don't even have to sweat. Check Adapt NCLEX on B-Sharp and you'll be fine. Number 5, what do we have? 20-year-old G1P0 present to the GYN clinic for lab follow-up. A serum alpha-fetoprotein AFP level was very low, very, very low. Which of the following the nurse should suspect? Which one? Select or apply. This, I want to teach you something you have to know. AFP can be high or low. When they're very low, it's mostly Down syndrome, okay, or trisomy 18. When they are high, it's neurotube defect. So this was very low. So I take neurotube defect, spina bifida, or anencephaly. That means the dysfunction of the brain. Basically, they're missing a lot of big chunk of the brain. So this is gone. I intentionally put trisomy 21 in order to show you that they can put trisomy 21 instead of Down syndrome. Trisomy 21 is the same as Down syndrome. So this is right, and trisomy 18. If you don't see Down syndrome, choose trisomy 21. So that's the right answer. Okay. Number 6, what do we have? Same concept. A nurse is caring for a client admitted for what? Pneumonia. During assessment, the client started yelling at the nurse and using what? Derogative words. The client has a history of violence. What is the next best action? Simplify it. Make the thing very easy for yourself. Rewrite it, 4 lines. You're seeing a patient who is not being nice to you and yelling at you. What should you do? Safety. Safety, safety, safety. So what do? Get out of there. Remain calm and continue the care. Not a good idea. Tell the client to stop using derogative words. He's not going to listen to you. He's going to be mad. Let him cool down. You call security, you worsen the problem. Leave the room. Tell the client the time you're going to return so that he will be expecting you. That is the way you do therapeutic communication. Number 7, what do we have? A nurse is caring for a 6-hour newborn. Which of the following on assessment need to be reported to the PCP? Assessment that need to be reported. That means it's a priority. Which of this you should not see it? When you see it, you should worry about. It's less than a day old. Heart rate 110 to 160. This is good. Respiratory rate 30 to 60 is good. Chest circumference 30 centimeters. Head circumference 45 centimeters. I want to show you a trick. Whenever they give you chest circumference, they're going to give you head circumference to trap you, right? To see if you understand it. Chest circumference, if you have it, just add +2. So somebody who chest circumference is 30, I just add +2. I should get at most between, the head circumference to be like 32 or 30, up to like 37. You can add 2, like multiple 2s twice. So maybe you can say 32 to 34, 35. Average is like 32 to 37, most people. So based on this client head circumference, if you had 2 to 30, it will be 32. This guy is 45, even bigger than the average people. That means there's something. This is hydrocephalus. He may have some ICP issue. This we got to tell the doctor. So the chest circumference plus 2 should give you head circumference. That's the concept I want to show you. This is another concept. And next one, to assess client temperature using the hand. Which part of your hand is best to use? So this is your hand, 5 fingers, right? Which one do you use if you want to check the temperature? Every portion of your hand has some sensitivity. So this is a physical exam you should be very good at. Okay, your palm, okay, the palmar side is so strong. That's why you can touch things where it doesn't bend that much when you touch with your palm. So your palm is not good. It's not sensitive for temperature. It's sensitive for vibration, things that are vibrating. Okay, your fingers are things that are pulsating. So that's why you use it to check pulse, right? And position sometimes. The dorsal surface here, the back of your hand, is very good for temperature. So when you see a question 2, they say you're going to assess a kid's bathtub, you put him in a bathtub, you want to check the temperature, use the back of your hand, not your palm. The base of your fingers is also good for vibration. So the right answer is use the dorsal surface to assess the temperature. Number 9, a newness is auscultating a client's lung sound. Which of the following indicate correct understanding of the assessment? These I just want to give you some concepts you have to know. When you have the stethoscope, okay, you have the smaller side and the big side, which is the diaphragm, okay, and this is the bell side. The diaphragm is used for high pitch and bell is used for low pitch. At the same time, high pitch, you got to press firmly, key physical exams. Low pitch, softly or lightly. Okay, so this is a long sound. Long is what? High pitch. This question requires you to take your time and figure out all these things. Long is a high pitch, so I know I'm going to use the diaphragm. There's taking scales, I take the bell side off. Now I'm using this. See if I put lightly or firmly. I use firmly, therefore this is your right answer. Diaphragm side plays firmly on the body part. That's classic, good answer. You see, test taking strategy. Same thing here. After teaching new graduate about peri-operative care, the new graduate know that timeout occurs at which phase? Which phase is of the peri-operative? Peri-operative related to surgery, okay? There's a pre-admission care. When you come in, they check your belongings and make sure your consent, everything is in place, okay? Then they take you to surgery. They do intraoperative care where they do the surgery. Then when you finish, you go to what? Post-anesthesia care. That's where the immediate post-op, where you go there and make sure you're awake, you're breathing, your temperature is okay. They take care of your respiratory, your saturation, everything. Then post-operative care, that's where they take you to the ward, okay? Where does timeout occur? Timeout is related to safety of surgery. And this is what we do intraoperatively to make sure the nurse, everybody in the room knows who they are, knows who's function, what we're going to do, that whatever we say we're going to do is under consent and everybody agree. So these occur intraoperatively. This is the end of it. Thank you for watching. Thank you for sticking around. Subscribe for more. This is 5 of these videos in that series of fundamental to yourself and all the best of luck. Thank you very much for sticking around. Bye.